we're going to hop into the questions. We're going to start off with some general ED questions here. So first question here is, can diet and exercise improve the effectiveness of some of the ED medications we covered tonight?
Yes, absolutely. So diet and exercise can do a number of different things. One of the most important ones is weight loss can help improve exercise tolerance, libido, and increase your testosterone levels as well. So diet and exercise can absolutely help.
Alrighty. Next question here. Can I use Triix injection one day and the next day use Viagra?
Yeah, you absolutely can. So you can actually, I tell my patients that you can do Triix on a daily basis. I don't recommend that patients give themselves a second injection the same day, but you can do Triix one day, you can do sildenafil the next. Most guys that have erectile dysfunction that's so bad that they need Triix really don't get very good erections with sildenafil anyway. So most of those guys, number one, won't get that good erection with the sildenafil, or number two, and this may be what someone may have, erectile dysfunction can also be partially psychogenic. Doesn't mean you necessarily have to have a problem with your penis, but we are all designed to run away from tigers in the jungle, and the fight or flight response prevents you from having an erection. And so if you if you have any anxiety over your erections, if you are worried about your erection at all, you kind of activate your nervous system and you can kill your erection. Like if you're ever having sex and you think, is my erection good enough? It really makes it hard to get an erection. So if sildenafil works one day, but you need injections the next day, it may not be just a problem with the penis. There might be some aspect of psychogenic erectile dysfunction.
Alrighty, great. Next question here. Do ED meds have a negative impact on patients with AFib?
No, the erectile dysfunction medications can be used, and you do have to be careful with some of the oral agents. It's not very common that any of the injection agents cause systemic side effects, but the oral agents can cause blood pressure changes. And so patients with AFib that's stable and medication controlled usually don't have any problems at all. But you definitely want to speak with your cardiologist beforehand.
Alrighty. Next question here. What are the best treatment options for ED caused by venous leakage?
So there are a few different options you can consider. You can try intracavernosal injections. However, with venous leakage, unfortunately, you get the blood flow in, you just unfortunately can't keep it in. So some patients will do injections followed by using a silicone ring, kind of like we use for the vacuum pump. They can try injection, they can just try a vacuum pump, or those patients need to go on to a penile prosthesis. What we'll do in the office to diagnose someone with venous leakage is do what's called a Doppler study. In the Doppler study, patient comes in the office, we give them an injection of Triix, and in the office, we look at the blood flow in the penis. I tell patients that it can sometimes be helpful, and honestly, not always, because even if we do a Doppler study to find out the problem or what the issue is, the treatment is usually my practice about the same, right? We try pills, we may try the gel if they want, or then the injections, and we still do a stepwise approach before I recommend anybody goes on to surgery. However, really unfortunately, if you have significant venous leakage, in the end, most patients have the most satisfaction going on and having a penile prosthesis placed.
Alrighty. Next question here in the general ED section, saw this one more than once. People are wondering if excessive porn watching can lead to erectile dysfunction or any other type of ailment.
That actually goes into partly the psychogenic nature of erectile function. So my answer, short and sweet, is no. It doesn't cause changes or problems with your penis. And most of the erectile dysfunction we're talking about are patients with penile problems. However, porn in general does unfortunately give men an unrealistic viewpoint on sexual activity, both sexual interaction and for penile length, girth, and length of sexual activity. So number one, all of the guys that you see on pornography are using intracavernosal injection to give them an erection that is as firm as they can get and lasts for at least an hour to 3 hours for them to do enough filming. On the filming as well, when these guys orgasm and ejaculate, they actually will cut that out if it happens early, and then they've already got the intracavernosal injection on board where they can continue having sex, and they just cut out where they lost their erection. On average, people have sex, there are studies that show that average sexual activity is somewhere between 4 and 7 minutes, and so people having sex, all over different parts of the house is not typical for 45 minutes to an hour at a time. So unfortunately, pornography gives unrealistic expectations for men, and because of that, unfortunately can lead to mental worrying about their erections and the whole psychogenic erectile dysfunction.
Certainly. All answered. Alrighty, next question here. This one is about intraurethral gel. This person says, or they'd like to know rather, how do they keep the gel from coming out when they are trying to put it in? They usually are able to get about 75% to stay in the urethra, and the rest will come out.
Yeah, that's the most important thing, and it can be hard, and some will leak out as long as you get the majority in. So when you're starting, for the one that I use, the compounded medication I use, you're usually using about half of a milliliter of medication or so. And so you push it in, and then it is right as you pull out the introducer, the syringe for it, you have to squeeze the tip of the penis. And it's so important to massage the medication down the urethra. Remember, urethra is on the bottom of the penis, so massaging the bottom of the penis from the tip down so that you get it into the penis. And some will eventually leak out, but really you just need to massage it in and up into the penis as much as possible. If some leaks out, it's not the end of the world. But it's the guys that will just push it in and then take out the little plunger and just let it continue to leak out. They don't get any response from it. So,
alrighty. Next question here. What can be done for patients who have ED after a prostatectomy with no other ED treatments currently working?
Yeah, if you've exhausted all available treatment options, then a penile prosthesis is your option. And there are different available prostheses. Typically, the 3-piece penile prosthesis, the one that I discussed or showed the pictures of, is the best option for the most natural erection. And that means, when I say natural, I mean an erection that is deflated when you want it deflated, and then pumped up and rock hard when you want it inflated. It is not uncommon, unfortunately, that surgery we do for prostate cancer leads to erectile dysfunction. We try to spare the nerves as frequently as we can, but that doesn't always work. And sometimes we can't spare the nerves because we're there to treat prostate cancer. So really the best option for anybody after surgery that has tried other available options or penile rehab, the best option at that point is to consider surgical intervention. And with the penile prosthesis.
Alrighty, certainly. That leads us to our next grouping of questions. These are going to be some ICI focused questions. So first one here is Quadrimix stronger than Triix?
Quadrimix is stronger than Triix. It has the addition of atropine, which can help. And so we offer it to patients that have pretty much, I typically in my practice go from, I don't actually use much Bimix unless patients have pain with Triix, because some patients don't have pain in the penis. So it's pretty rare that I personally use Bimix. Most patients are fine with Triix, and we titrate them up based on different levels. And this is a personal opinion, different people. I tend to find that once patients have maxed out on Triix, they, rather than trying more to going to Quadrimix, they end up going on and we end up doing a penile prosthesis. But yes, Quadrimix is a bit stronger, works with a little bit different mechanism by adding the atropine, and can be titrated to help guys for sure.
Awesome. Just a follow-up question to that one right there. So can you elaborate a little more on the medicine and Trimix that is going to cause some pain for some patients that is not advised?
Yeah, so you've got phentolamine and you've got your prostaglandin. So bottom line, it just everyone's different, honestly, is what I tell patients, and so it's a trial and error. So you've got your phentolamine, your prostaglandin, and oh my god, phentolamine, prostaglandin, or your
Prostadil is the difference.
prostadil is prostaglandin, totally blanking on our third. But bottom line, some patients do have pain with Triix, unfortunately. So I bump them back down to Triix. They usually have improvement in that pain.
Alrighty. Good there. So next question here is, this person says they often experience a bent needle when injecting. Would an auto-injector help this process?
They can definitely try an auto-injector. Auto-injector I found works best for patients that just have trouble with that, like injecting themselves, because with injections, you want to be definitive when you put the needle in, and it is scary to do that. So auto injection usually works best for patients that have trouble committing to putting the needle in. You really just want to put the needle in. You don't want to just kind of poke around trying to make your decision. And so they can always try an auto injector. They may already have some aspect of penile fibrosis there that causes the needle to bend. So it's something that they can try, but a lot of guys have Peyronie's disease as well. And Peyronie's disease can not only cause problems with penetrating, it can cause erectile dysfunction because you may lose some of the veno-occlusive aspect of the erection. And so those patients, they can try different things, but a penile prosthesis will fix both the curvature from Peyronie's disease and the erectile dysfunction.
Alrighty, next question here. It is difficult to inject with shaky hands. Any solutions or tips?
Yeah, I have about a fifth of guys that actually have their partner or their wives do the injection for them. So that works really, really well. Unfortunately, it can be a real challenge. And those patients that have an intention tremor or can't give themselves an injection really are just not great candidates to do injections and do well with prosthesis placement. So you aren't forced to do injections if you can't administer the actual injection. But a lot of guys will have their significant others do it, and that works pretty well.
Alrighty, that's a great solution there. Next question here, saw this one again multiple times. If you're not sexually active right now, is there any need to use the injections?
No, I mean, you don't have to use them. It's really if you want to use them, right? We have medications and we have surgery that can fix your erectile dysfunction. But if you're not sexually active, you don't have to be. Alternatively, there's no age where you have to stop being sexually active. The oldest patient I've placed a penile prosthesis in was 93 years old. And he and his wife were still sexually active. He failed injections. He was actually doing them for about 10 years, and they weren't working anymore, and he wanted a prosthesis. So there's no age where you have to stop sexual activity. I just feel like patients that come in that tell me they're 60 years old or 70 years old, and they want to let it go. That's fine if that's up to them, but they don't need to do it just because they have erectile dysfunction.
Alrighty. Another question that came up multiple times is combining ICI with other modalities. So is it advisable to use ICI with the combination of PDE5s?
No, I don't recommend patients do it. Technically you can, I do have patients that do it, but the medications that are in Triix function and block the phosphodiesterase, they are phosphodiesterase inhibitors. So you're actually injecting medication directly into the penis, and you don't or shouldn't need to add pills. I have plenty of patients that do add a constriction band, like a silicone ring that you can get on Amazon, or that comes with a vacuum erection device after they've done their injections. Now, you want to make sure that I would give it time to get as much blood flow in beforehand as you can. Then you put the silicone ring on. But that's definitely an option. But I personally don't recommend patients take the oral PD5s and injections at the same time.
All righty. Let's go on to some implant questions, and then once we run through these, we can circle back to some other ones in the other groups. But start off with the implant questions. What are some questions that should be asked when looking for a surgeon to do your implant surgery?
So I think one of the most important ones is expertise, how long someone's been doing it. And you want someone that feels comfortable with implants. There are numerous places and people throughout the country. You can get them done in every state in this country. And so comfort and surgical expertise is very important. Now, revision cases, if somebody has a penile prosthesis that isn't working anymore, or they've had an infection in the past, the complex procedures, you really want them done by somebody that is specialized in revision procedures. So, but I'd say really talking to your urologist, making sure that they have done a number of them and feel comfortable is very important.
Alrighty. Before receiving a penile implant, would it be best to use a traction device to increase the penile length?
So patients, there have been numerous studies on this, and you can always try. However, what I tell patients is that it is important to know we place the longest size device that we can place at the time of your surgery. So when we put in a device, we don't check beforehand and say, hey, this is what we think we're going to put in. It's not a small, medium, or large. These penile prostheses are sized to the centimeter on the length, and the length of the penis is determined with a measuring device during surgery. So you're asleep. This surgery, I should have mentioned, takes about 45 minutes to do. So you're asleep for 45 minutes to do the surgery. And we measure the entire length of the penis and size the prosthesis to within a centimeter. And we put in the largest prosthesis that we can absolutely fit to within a centimeter of the penile length.
Alrighty, awesome. Next question here. This person wants to know if there's any risk of losing sensitivity in the penis or the ability to achieve an orgasm.
Excellent question. So no. So the incision for the penile prosthesis surgery is made on the scrotum. However, all the nerves for penile sensation run through a neurovascular bundle that really is on the back side of the penis. And so we aren't near any of the nerves at the time of surgery. We're on different sides of the penis pretty much. And so you have normal penile sensation and normal orgasm afterwards.
Awesome. Next question here. Is the device uncomfortable when not in use?
No, so it's not expected to be uncomfortable when not in use. The first few times you pump it up and are using it can be a bit uncomfortable. So when you're in the recovery phase, we leave, or at least I leave the device partially inflated while you're healing, because it kind of heals with a bit of a capsule around it. And if you leave it inflated, it kind of heals with an inflated capsule. If you left it completely deflated as soon as you put one in, then you can have more discomfort for a while afterwards as things stretch out when you pump it up, because they inflate and they also elongate a little bit after pumping them up. And so, no, they do not typically cause pain in the deflated state, but can be a bit uncomfortable for the first few times when you inflate.
Yeah, I can imagine that would take some getting used to. Alrighty, next question here. Does a penile implant adversely affect urination by any chance?
No, it doesn't adversely affect urination. You aren't expected to notice any change or difference in your urination after one's put in place.
Sweet. Next question here. Is there any way to regain lost length related to Peyronie's disease with an implant?
So some patients do regain length. It's very dependent on how bad the Peyronie's disease is. And so oftentimes, if someone has significant amount of plaque beforehand, we actually will do Xiaflex injections first to try to break up that plaque, followed by the penile implant. And I think one of the best ways to know about the length someone will have at prosthesis placement is taking the head of the penis and stretching it away from your body as far as you can. That really shows the stretched penile length that you can get and what we can give patients from surgery. However, I tell all my patients, your stretched penile length is really what you have. We cannot give you more length, and I can't give a guy a penis that's 2 feet long that they can throw out the window while they're driving down the road. It's just not realistic. And so it's very important to know that your stretched penile length is really what you're working with now. We can always try, if someone does have significant fibrosis from Peyronie's disease, we can try injections to try to break up some of the scar tissue that's there. But we have to have realistic expectations what we can do for patients.
Certainly. Next question here. When using an implant, is it necessary to take PDE5s to help arouse the head of the penis?
No, so it's not necessary. Some patients do use PDE5s and can use it. It's not a problem at all. You cannot do injections once you have had a penile prosthesis placed. So no injections at all should be anywhere near the penile prosthesis. But some patients do notice that they get some more engorgement in the head of the penis when they take PD5 inhibitors, so they absolutely can use it if they like.
Awesome. Next question here. Is there any way that a penile implant would be able to help with urinary incontinence?
So for the aspects of this talk, my answer has got to be no. Although there are some things, there are some times if someone has had a sling in place or a couple little maneuvers that can be done where it can help. But for this talk, we say that no, a penile prosthesis is not expected to change incontinence at all.
Alrighty. Saw this one a couple times, so I thought I'd ask it again. But what are some of the long-term risks that you'll see with an implant? I know we already covered them, but
yeah. So the biggest long-term risk patients need to know, or honestly, the biggest short-term risk is the risk of infection. The biggest, once penile prosthesis is in, long-term risk is really just device malfunction. And so, because these do have kind of an expected lifespan, and I tell patients that's somewhere around 8 to 15 years. And so if it stops working and it needs to be fixed, then it unfortunately commits you to a second surgery where we have to put you to sleep, take out the old one, we wash you out, and put in a brand new one. It still only takes typically about 45 minutes to an hour procedure, but if you have a malfunction, unfortunately, you have to do that. There are other rare things that can happen I tell patients about, where if you leave it inflated, so it should stay deflated if you are not using it. If you leave it inflated at all times, because the implant does gain some length when you pump it up, it can put pressure inside the penis and you can get what's called an erosion. And so I tell patients that long term, if you do not deflate it down, it can cause an erosion because it does gain length when you pump it up. And so that would be the worst long-term complication if they left it inflated at all times.
Alrighty. Next question here I thought was pretty interesting. Is there any advancements planned to make the implants inflate from a remote control or phone app, I guess, rather than the button that's currently implanted in the scrotum?
I do not know if I currently am at liberty to say. I can say that that's something that is in the works.
Wow, that's pretty cool.
But I don't know that it's not commercially available yet, and they're working on it. I think that's all I can say.
What course of action would a patient have if they happen to be unsatisfied with their implant?
So it really depends why someone's unsatisfied. And there are a number of different options if someone's unsatisfied. However, I would personally say that in practice, once we've worked through the different options on, is it a problem feeling the device and pumping it up themselves, or the issues with deflating, if it's pain associated, where's the pain coming from? Often when that happens, and it is not common, sometimes it involves a revision where we have to take it out and put a new one in. That usually fixes the issue. It just depends where they're having that issue or why they aren't satisfied. So it becomes a bit nuanced when it comes to that issue, unfortunately.
Sure, that's different patient to patient. So we're going to circle back around to some general ICI questions here. Saw this one more than once. Injection therapy, it can cause scar tissue. So what are some of the ways that can be avoided or eliminated?
So when you're doing your injections, I try to have people use their dominant hand to start out. But once you've been doing injections for a little while, and it doesn't really take that long to learn, usually people can become facile on both sides. And so I recommend rotating different areas along the shaft of the penis rather than always going to the same spot. You do not inject into the head of the penis. You don't inject into the bottom of the penis, we were saying, but really you can use both sides because the corpora cavernosa, the erectile tissue of the penis, is on both sides of the penis and they communicate. So you can use right side, left side, and rotating different locations is typically best.
Alrighty. Another ICI question here. I believe this is venous leak related, but this person says they noticed that lying down following a Triix injection significantly decreases the rigidity of their erection. What may be causing this?
Most guys actually get best if they are standing up. And so really it's gravity related and maybe associated with some venous leak, but most guys notice if they just give themselves an injection and sit down or lay down, it doesn't work as well or they don't get as good a response as if they are standing up. And really it's gravity. So gravity's helping the medication do what it's supposed to do. So I recommend staying upright afterwards for a little bit. Always hold some pressure right after the injection for 30 to 60 seconds. But after that, it's best to be up walking around for the next 5 or 10 minutes.
Alrighty, we got another implant question here. So does having an implant cause any complications to possible future prostatectomies?
No. And so if you have a penile implant in place, depending on where the reservoir is, it can change a little bit of the surgical approach. If the surgical approach is done with what's called a Retsia sparing technique, that's an approach from actually, say, behind the bladder and prostate, then it causes no difference at all. If it's a more traditional robotic prostatectomy, what we call a robotic radical retropubic prostatectomy, then the reservoir is usually seen, but it's usually encapsulated and not really within the field.
Alrighty. I know we already answered this one, but I saw it come up again, so I think we should ask it one more time. How long after the implant can one have sex?
The soonest I have patients learn in the office how to use it is 1 month. And technically you can do it as soon as you are not in discomfort. But I have patients, I saw 2 people today in the office back 1 month afterwards to teach them how to inflate and deflate. So 1 month is when I teach patients to inflate and deflate. I also tell patients, after 1 month of surgery, they may still have a little bit too much discomfort. I mean, they feel good after surgery, but it's still a little bit too much discomfort to actually have intercourse or masturbate yet. But I still teach them how to inflate and deflate at 1 month. So that's kind of the expectation.
Alrighty. Got time for about 1 or 2 more questions. So next question here. Can I use the injection therapy and a VED pump at the same time or one after the other?
Yeah, absolutely. And so you inject first. So you do intracavernosal injection first, and then I would give that some time, and then you can try to use the VED pump to try to get extra blood flow in. I have a number of guys that do that all the time. And then once you have as much blood flow as you want or can get in there, you put the constriction band, the silicone band around the base of the penis, and patients do great with that.
Alrighty, we got time for just one more quick follow-up question. So when you're using a penile constriction ring and ICI, are you supposed to put the ring on prior to the injection or following the injection?
No, following the injection. So do your injection first, and then put the band on later.
Alrighty. Well, that brings us to the end of our event, so I appreciate you taking the time to answer those questions. We're just going to go ahead and read off our remarks. If you'd like to learn more about ED, you have a few options. There will be more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837 or log into the MenMD portal to schedule an appointment with a MenMD personal health assistant. If you'd like to compare any of the treatment options that we just discussed on tonight's event, you can do this by going to menmd.com, navigating to our erectile dysfunction condition page, and then scrolling down to the treatment section where you can select up to 3 ED treatments to compare. And finally, you can learn more about penile implants and insurance coverage by visiting edcure.org.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.